So here we are with my new friend Mark. He and I have been seeing a lot of each other. He's touched me up in my metabolic testing. They're about to take some blood out. Do you want to talk about what we're doing?
We're just going to take some, 2 tubes of blood to do the PRP for your elbow. And then after this, I do that, we'll put it into the centrifuge and we'll spin it.
Right into that machine?
Yep, it's right over here. Yep, it's put it right here. I close it down and it starts and it goes.
Oh,
so
that's
8
awesome.
minutes for 15 RPMs.
And so it spins my blood so that the platelets
Separate.
separate on top.
Yep.
Oh, here we go.
All right.
Here comes the gruesome part. We're going to get my blood. Well, good thing I hydrated. I had an omelet this morning, so this blood draw should be pretty easy. So, always trying to bring you new things, and this PRP treatment, very effective, a lot of good science behind it, and Dr. Silk has watched it work many times. So we talked about my elbow, my blood's been drawn, it's been spun in the centrifuge, and now we're going to go through the procedure. So, what's going to happen to me?
Well, you had food and water. I told you to make sure that you're eating so that you don't feel faint with needles. Most people do fine, and we're using very, very small needles. What I'll do is I'll have you lie on your back, and I'll clean the elbow off, take a quick look with ultrasound, and then inject the local anesthetic after I spray it with a cooling spray. When I inject the local anesthetic, I'm going to ask you if this has gotten rid of a degree of your pain. Because if we can make the pain go away with a local anesthetic, then we know by definition we're in exactly the right spot.
Okay.
I use a small vibrator tool to move the local anesthetic around in the tissues, dissipate it so that there's not a bolus or a ball of it in there that's in the way, and then putting the ultrasound over the medial epicondyle of your elbow, we'll find that tendon spot that's all inflamed that you saw the other day, and the needle will slide in, inject your plasma, which we've concentrated with a double spin, and put a Band-Aid on, and away you go.
Wow. And then for recovery from something like this, I know we spoke about it before when we were first doing the consult on it, but back to business as usual tomorrow? Or?
The only thing that I would tell you is probably don't do a lot of exercise with the arms today, push-ups, pull-ups, playing tennis, things like that. If tomorrow everything feels good, then you can go about totally normal activity. The Band-Aid stays until tonight. And ideally, if it's possible, 2 weeks from now, I'd like to have you go to Punta Cana.
Yeah, I like that. I like that. That sounds real good.
This is your plasma. You can see it's cloudy yellow. It started out as red blood, and then it was a clearer solution, and now it's cloudy because we've concentrated it significantly. And you go into our numb spot. We inject down into the problem area. You can see the needle coming down through it. And we slowly infuse the plasma. The most I would anticipate you'd have side effect-wise would be a little aching because of the pressure from that extra 1 or 2 cc's of fluid. Don't overuse it today. Start using it normally tomorrow. And I tell people to plan, at least in your head, on doing an injection 3 times in a row every 6 weeks. Many people, especially with elbows and wrists, are better after 1.
Oh, okay.
But we'll touch base along the way and plan on tentatively re-injecting it after about 6 weeks.
So if you were to describe the process that's just happened where we injected a couple cc's of my platelets into here, and now they're obviously dispersing, spreading out.
And they're breaking apart. They're now in a place they're not supposed to be. So they're breaking apart and they're releasing chemicals. The chemicals are things like growth factor and cytokines and a whole host of other things that are important for healing.
That's awesome. Well, thank you for this. Thank you very much. Yeah, I'm excited. There we are, Journey. Another option for healing, another option for your joints. I took the journey first. Your turn.